Bipolar disorder in children and adolescents. The objectives are going to be to identify some of the symptoms of bipolar disorder, where it comes from, and the statistics of bipolar disorder in kids. Describe the challenges of diagnosing bipolar disorder. Show the other conditions that go along with bipolar disorder, and also the conditions that we can confuse bipolar disorder with, as well as to discuss the treatment plan. So our first half is going to be the first three objectives, and the second half is going to be spent on treatment, because there's a lot of treatment dilemmas in bipolar disorder in kids. I'm going to mention mood disorders first, because mood disorder is usually the diagnosis that you will see on many of these kids. When I say many of the kids, the ones that are diagnosed at the age of 6, 7, 8, 9, where we don't have a clear picture that fits with the DSM-4. Just to give you a little bit of background. For psychiatrists and psychologists also, to make a diagnosis, we are supposed to follow some symptom guidelines. They are in the DSM book, right? It's kind of our Bible. So, and that is meant to keep us from, it's meant to keep us from overdiagnosing or underdiagnosing, and also to keep a level of kind of generalized understanding of the condition. But in kids, it really doesn't fit. When you look at the DSM-4 for bipolar disorder, it doesn't fit in kids. So what we do is we call it mood disorder. And you'll see that bipolar disorder is a mood disorder. We usually diagnose mood disorder, NOS, until we are completely sure that the symptoms do fulfill the criteria for bipolar disorder. Any questions? That usually is it's confusing, because you will hardly ever, you will hear the parents talking about bipolar disorder, but in the paperwork you won't see the word bipolar, you'll see the word mood disorder. So we have different types of bipolar disorder. We have the bipolar 1. The main criteria or the main symptom of bipolar 1 is that there is a manic episode. So you have manic episodes with and depressive episodes. But what defines bipolar 1 is a full manic episode. And we will get to the point where we talk about what mania is in kids. Okay? But mania basically is high level of energy, grandiosity, which means you're pretty much above everything else. You know everyone, you have superpowers, that kind of thing. And again, we'll talk about that in kids in a little bit. Bipolar 2 is depression and hypomania, which is a notch below mania. In other words, you're very energetic, you still have these feelings of grandiosity, but you can function. Okay? And then bipolar NOS is, it really doesn't fit 1, it doesn't fit 2, but it has a lot of the symptoms. And usually the steps are, you diagnose mood disorder, you clarify symptoms, you go to bipolar disorder, NOS. And then as they become adults, then we can clarify a little bit better whether they're bipolar 1 or bipolar 2, especially if they have a manic episode, then you know that they're bipolar 1. Major depressive disorder. We are going to talk about major depressive disorder first, just a little generalization, because usually in adolescents, not so much in the little guys that we're talking 6, 7, 8, 9, 10, the pre-eds, but in adolescents, you will see that the first diagnosis is usually going to be a depressive disorder, major depressive disorder. The patient usually comes in depressed. And that happens in adults also. So they're diagnosed with this. They might have multiple episodes of depression before they have the manic episode, or before they have hypomanic episodes or hypomanic symptoms. So it's very important that not usually, but when an individual has major depressive disorder, 20 to 40% of these in the younger population actually are going to develop bipolar disorder, right? They actually did have bipolar disorder. It's just that their first episode, first or second, or first multiple episodes were of depression. Now, just so you can keep in the back of your mind, this is important when we go to treatment, because usually these individuals are treated first with antidepressants, and then we see, wow, okay, they didn't work, it was bipolar. And I'll explain that in a little bit as well. So what are the symptoms of depression in kids? In pre-eds, we're going to hear about the negative self-image. I'm bad, I can't do anything, my tennis shoes don't make me run fast, people don't like me, I look ugly, I smell terrible, I'm dumb, I can't. So a lot of just negative comments. Somatic complaints, things hurt, right? Headaches and stomach aches are the major somatic complaints. It's not so much muscle aches. Muscle aches come in the older population. When I'm talking about adolescents or young adults. But usually in the little guys, it's mainly the stomach aches and the headaches. Social withdrawal, they don't want to play with their friends. Or they had friends and then they're moving away from them. Now remember, it's very important that these are changes from their baseline. Because you can have a child that has these, not so much the negative self-image, but maybe they're socially withdrawn from baseline. So we're looking for changes in their baseline behavior. Kiddos that used to play on the playground and now they're just withdrawing, kind of staying to themselves, and they don't want to really engage. Then you ask them why, and then you figure out that there's negative self-image, they feel insecure, they might feel unsafe. Behavioral problems with anger outbursts. Again, different from baseline. Anger outbursts where they have very low tolerance for frustration. They're redirected, and most kids get upset when they're redirected, right? But upset can be just like bothered and they roll their eyes, or a full-blown anger outburst and losing emotional control. And so that's one of the other symptoms of the depression. As you can see, we're not even naming sadness. We don't say sad or depressed because they usually don't even mention that. It's more anger. And that's what's very confusing for parents. But again, with the behavioral changes, we mentioned isolation, rejection sensitivity. Kids kind of bug each other, right? And with a person has good self-esteem, or just a decent self-esteem, let's say, they learn these games of, they'll tease each other and they think it's funny, right? But it's a back and forth, it's even. Rejection sensitivity is when someone makes kind of those regular comments and the other person feels rejected when they never really felt that before. So maybe at school, someone made a comment about, oh, no, you can be on the other team. Regular comment, it was just that they were trying to distribute kids on the team, and then that child feels like they were rejected. And then they go back to that negative self-image. At home, mom says, wait a minute, I need to cook. And so instead of understanding it's a time factor, then they understand you just don't love me, you're rejecting me, I have to be on my own, you don't love me kind of thing. And then thoughts of death or dying. Remember, that's one of our safety issues. Suicidal ideation, thinking that they're not worth living, feeling that it's better off if they're dead. People would be better off around them if they didn't exist, or actually thinking that they are going to take their lives. Little guys do think these things. Now, what we consider unsafe isn't necessarily what they consider unsafe. So, a child that is found, for example, trying to hold their breath until they die. We really don't consider what they're doing, because in their mind, their intent is to take their life. And that's what we need to look at, right? Sometimes they do things that we're like, obviously you can't, take your life that way. But for them, that's what counts. For them, it is with that intent, and that's what we need to look at. So that it would be considered suicidal ideation or suicidal plan. We have to be very careful with that because we don't want to minimize. Then we have the adolescents. Now we're really getting angry. Okay? Now it's this kind of constant irritability, but they can describe more depressive symptoms. Even though they're angry, they can at some point say, I am kind of sad, or they'll say they're crying more. But there's a lot of hopelessness, and that word boredom really comes through. That word boredom comes through in a lot of different presentations. In ADHD, it comes through, in anxiety, but in depression, because of the lack of motivation and the lack of initiative. So they don't really know how to occupy themselves. They might have known how to, but now they can't really think about it because they don't have, their thoughts might be somewhat disorganized. Social withdrawal and isolation. Again, you have the teenager that used to be in sports, that was in attended clubs after school, and grades were good or decent. And then you see a drop in all this, a change in their overall socialization. Sadness, like we mentioned, isn't only expressed by words, verbal expression, but also in their clothing, in the kind of music they're listening to. Again, this is a change. Not so much if you see a kiddo that's, wears regular colored clothing, kind of bright, and then all of a sudden they're changing. They're covering their wrists, they're wearing gloves, you think about self-injurious behavior, they're wearing all black, they're covering their face with their hair. So what we're looking for, again, is changes. Now, just because they're a change doesn't mean, oh my gosh, they're depressed. It has to be kind of a whole, a whole change in pattern, again, with all these other symptoms that are going on. Not all, but most of them. And then we have lack of motivation, skipping, low grades. Usually when they're skipping, you have to ask them, where are you going? Why are you skipping? Very few kids just skip and then stay and go to the library. They're usually not making very good choices when they're skipping. So you really have to ask about drugs, if they're going out with their friends somewhere, other things like that. Loss of appetite or binge eating. Basically, a change in appetite, okay, is also what you're looking for in depression. And then a sleep disturbance. Now, this sleep disturbance is kind of difficult because the sleep disturbance doesn't so much happen in the little guys, but it does happen more in the adolescents. And it could be sleeping more when you're depressed, but if you see a depressed child and they're sleeping less, then that's kind of a red flag for something else going on. And it could be what we're going to talk about, which is bipolar disorder.